Hello and welcome back to another episode of the 2020 podcast, Canada's number one optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me. I'm always so grateful for everybody who's tuning in, taking the time out of their busy day. The podcast has been growing and your support has been incredible. So thank you so much. I'm going to ask you one quick favor right off the top. We had a little glitch with our podcast, Apple Podcast reviews, and they're all gone. And so I'm just asking if you wouldn't mind taking just a second if you're on Apple Podcasts, scroll down to the bottom and leave a review or leave a rating. That truly helps us get this content out to our colleagues, especially when I have such amazing guests like I do today to share their insight and help us grow in our practices. Dr. Mila Ioussifova, thank you so much for coming on the podcast. We've been talking about this for so long, so I'm really, really glad to have you here. Dr. Ioussifova graduated from the New England College of Optometry, go NECO, with honors. She completed her residency and is a fellow of the American Academy of Optometry. She served as an adjunct clinical faculty at the Pacific University College of Optometry for 10 years and was an examiner with the National Board of Examiners of Optometry. But more importantly, in this conversation, Mila is a clinic owner and she really, really is an expert in dry eye and is doing so many things at a level that truly 99% of us are not doing. And I'd love to learn from her in the dry eye aspect. And she's a huge advocate for our overall wellness and gut health. And she has a new program, a digital program that's available to educate us on the importance of gut health for eye health, which is called I Thrive Wellness. Thank you so much, Mila, for joining me. I'm excited to have this conversation.
Thank you so much for having me. I'm super excited to be here.
So, where do we start? Let's start with maybe we'll go kind of more recent and then we'll go backwards. Let's talk about gut health and what have you, as far as your training and education, have you done to learn about this, to become an expert in this? And then let's talk about the connection between gut and eye, because I don't think a lot of us are making that connection.
Yeah. Well, y- I think it all started from patient experience, right? We have patients in our chair. I mean, the reason why we start to do these advanced dry eye treatments because what was working before, like home remedies, treatments, were just not adequate. So a lot of us have, including yourself, have invested a lot of money and time into bringing these advanced tools and technologies to really treat the root cause of dry eye. So as I was, and I've been, doing that. I opened my practice 10 years ago. We just celebrated our 10-year
Congratulations.
anniversary. Thank you. So my investment into dry eye disease was early on. So I really brought on, IPL almost 6 years ago, and I brought on, LipiFlow even before that, and started doing all these, root cause treatments. But then over the years, that as I was seeing this really complex, as we know, dry eye is a multifactorial disease. So really complex diseases with multifactorial, other comorbidities like autoimmune problems.
Mhm.
I started, as I was, learning about these patients' overall health, uh, just lifestyle and diet and gut health and all of that kept, like, the more I was reading and learning, I was like, okay, there's more to this than just treating it on a surface with drops or even these tools like thermal or light therapies. So, and then the research is really growing. I feel like we're all on board with dry eye being a chronic and progressive disease now, so we're all doing everything we can. And
Mm.
same thing with I feel like the whole world of like microbiome and gut
Mhm.
health is like, it's not new, but we are paying attention to it now, right? So it's not a new concept. Like, we've known that obviously what we put in our body makes, it matters, and it will
It's like
affect
so obvious
everything.
we forget about it, right? I think is what happens.
Exactly. But I think the spotlight is back on that for good reason. So I was like, all right, instead of just recommending a blanket like eat healthy approach, like just eat healthy and make sure you sleep enough and things like that,
Mm.
I really wanted to learn about the whole world of nutrition at a deeper level, to be able to confidently talk to my patients when I am, discussing their supplements and dietary changes and things like that. So back in 2019, I decided to go back to school to study nutrition. It's a master's in nutrition program
Wow.
at the
Okay.
University of Western States. And the timing was perfect because then COVID happened and a lot of it was online anyway. So I was
Right.
able to continue with my studies during that time. And it's just, it just like has blown my mind how much is out there that we didn't know or I didn't know. And I feel like the more I learn about nutrition, wellness, gut health, the more there's to learn. But that's kind of how, it started because I wanted to help my dry eye patients. I wanted to give him the tools because patients would ask, right? I'm sure they ask you, what can I eat? What can I not eat? What's good for dry eye? What's not? And I just was like, I don't know. Let me let me
Yeah,
study this and get back to you. So that's kind of how it all started with me diving deep into this world of nutrition.
that's awesome, man. Talk about having a passion for something or really committing to becoming better at something. You went back and did a master's in this. That's awesome. That's really incredible. So definitely, I would position you as the right person to speak to on this topic. Now, obviously, being an optometrist and being highly trained in our profession, but then going back and getting this extra training and education in nutrition. It's funny because so many patients ask, right? What can I eat? What can I do differently to help my eyes? And I'll kind of be, mix colored full vegetable. Eat your greens and your eggplants and your blueberries and your whatever. And I'll say omega 3, and then I'll kind of stop there. I'm like, I don't know what else maybe could be helpful here.
Mm-hmm.
So there obviously is a lot more, and
Yeah.
it'd be nice to be able to share with our patients, what we can be doing to overall improve our wellness. On the gut health thing, I want to dive definitely into more to that for a second, but it's so funny. Like I feel like older cultures, the further east you go, you'll hear a lot about the importance of gut health. For like this is old, old, old news for them.
Yeah.
Like
Yeah.
my parents, my grandparents
Great.
always stressed
Exactly.
making sure your gut is healthy
Yeah.
no matter what. You're not feeling well. How's your gut feeling? I was like, what? How does
Yeah.
that make sense?
Yeah.
And they were clearly understanding this decades, if not generations
Yeah.
earlier.
Yeah.
And now it's like sort of coming to play here in the
Yeah.
Western world a bit more. I'll go to my mom and I'll say, "Oh, I've heard that ginger or something's good for this." She'll look at me like, "Are you like I told you that 20 years ago? What do you expect me to believe that for?"
That's so true. That's so true. I remember my, growing up. From originally from Azerbaijan, so growing up, I mean, we always there's no like fast food. There was, I mean, there is now,
Mm,
but there's, everything was, cooked from scratch, nothing
whole food. Yeah.
processed. But my grandma's table always, like with every meal, there was sauerkraut. There were, there's basically these
Right.
probiotics. Like you
Yeah.
have probiotics with each meal.
Yeah.
Something like bone broth with like, actual like collagen and things like that were something that you did once or, a week or once every 2 weeks. So that was like a part of breakfast. So now like those things that are like now all of a sudden are a trend, right?
Yeah.
People are like putting probiotics in capsules where like I
Yeah.
the previous generations, they were eating it just not like with each meal. That was
Yeah.
just probiotics were in your diet.
That's right.
um and like bone broth again, now they're like all like powders and like capsules or things that you just like have to pay for,
Mhm.
where before it's just like you go to the market and you get those those bones and nails and things like that, and you cook them overnight, and in the morning you had that bone broth with collagen and like all this gelatinous. I remember I was grossed out when I was a kid. Like that's disgusting.
Yeah.
How can you eat that? But my parents would give me like, no, this is good for you. Good for
Yeah.
your skin, your bones, your gut. So a lot of those things that are they're not new. Like I said, it's not a new science. Like it's not new. Our grandparents, our parents have been doing it, but then I think we in the last, I don't know, since the 80s, I guess. Like I was gonna say 20, but that's like 40 years.
Yeah.
So in
Crazy.
the last like 40 years, everything has changed, right? So cereals, kids eat, we're eating. I think again we're kind of getting away from that, but cereals were a big part of everybody's breakfast. So all
Mm.
these highly processed, highly sugary breakfast, that was like the first thing you eat. And so with the marketing and with the everything, like all these fast food and convenient food industry really took over. So everybody forgot about all the ancient ways of eating. We wanted everything in pretty packages and pretty
Yeah.
boxes with like some, maybe toys inside. That's how they got the kids.
Yeah, that was
And
awesome.
then, yeah, so then we start seeing all these like so much more disease. Autoimmune disease is it's on the rise. Like it's just like keeps growing.
Yeah.
And I have so many young patients with autoimmune conditions, and it's just like nobody says why. It's like I think everybody's
Mm,
just says, "Oh, I have an autoimmune condition." So it's like I have to go on steroid treatments when I have a flare up. I have to do it's like accepted. But my question was like, why do we have these diseases that are growing so rapidly? And obviously that's the answers. Our food really from the 80s changed
mm,
drastically,
yeah,
and we're babies of the 80s now are getting the consequences of that, what the diet, that the changes that happen
that's
during
right.
those decades.
That's right, and definitely we like, I mean, you're a parent, as well, and I'm definitely seeing with our kids, we're trying to stay away from certain things. We're not perfect and we're also not like super strict, but we are just like the obvious things, like don't eat the sugary, the Lucky Charms for breakfast. Don't drink too many of those juice boxes or whatever, little things like that. And my mom is, I mean, I think it's partly a grandparent thing too, right? The grandparents just want to give the stuff to the grandkids, but they're like, well, you had all that stuff when you were a kid. I was like, I know, we just didn't know any better. You didn't know any better. Now we know. Like, let's try to change that trend. But
Yeah.
let's say we're talking to, let's take that. Let's talk about your the program, the I Thrive Wellness. What are we aiming to do? What are you aiming to do with this program? Who's it for? What's in it?
Yeah. Well, first of all, it's a partnership with Dr. Celia Futch. So she is a good friend of mine and my partner, business partner in. We actually met during this program. So we were doing during our studies at the University of Western States. So she also did the same track, and so basically, after you do the classroom work, and you have to take this board. So it was like optometry school all over again. I had to take this
Really?
4-hour board exam,
Wow.
and then but then to get your license, your certified nutritionist license, you have to also do 1,000 clinical hours
Oh.
with a supervisor. So basically, we would have this cohort of students. We would, on Zoom log in and have to present nutrition cases. So clinical
Mm,
cases on like, here's a patient with these symptoms. Here's my, dietary protocol or supplement protocol, blah blah blah. So during that program is where we met, and her and I, all of our cases really involved dry eye patients. So that was kind of like the
mm,
moment that it clicked that
yeah.
okay, this is where we see the problem in the eye care. Like in our eye care, a lot of patients have dry eye problems, a lot of them have gut problems, a lot of them have autoimmune conditions. And one-on-one, we're helping a lot of these patients really successfully. So after we were done with the clinical that 1,000 hours of clinical work, we decided, why don't we put together a program that's accessible to more patients out there. So any doctor like yourself, if your patient's like, I'm if you ask them the questions like, do you have skin, if you see that they have on their questionnaire, they have eczema or rosacea, eczema, other like skin inflammatory, a lot of times they have gut problems. So that's a clue for you to ask, how's your gut health? Do you tolerate foods? Do you get bloating? Do you get pain in your stomach? Do you have regular bowel movements? I know you got to get comfortable asking those
Yeah.
questions from your patients. As eye doctors, we're not, but
Yeah. Yeah.
we're healthcare professionals. So, and sometimes patients will be like, "What? Like, why are you asking that?" But then that's again, that would be how you kind of make that connection. And if you don't have the tools or the knowledge yet to talk to your patients on like changes to make, that's what this program is for. So this program is basically designed, it's a 10-week step-by-step protocol for patients to go through, and they get recipes, they get supplement protocols, they get
Wow.
dietary protocols, they also get it's a support kind of program. So that it's a they get a forum where other participants, patients with dry eye, can ask
Oh, wow, that's
questions
awesome.
to each other from each other. They can talk, get responses from us, or they post questions there. So Dr. Futch and I will answer those. And the most valuable thing really that you get from this is you actually get one-on-one access to us. So we have these live sessions where
Mm,
her and I will get on and ask questions or answer questions. We'll have a discussion. Sometimes we'll do presentations. So again, a lot of it is on diet, nutrition, wellness, but also if they'll ask like, how's this related to my eye or whatever, we don't change what the prescribing doctor, if this is your patient and you have patient a certain protocol like IPL and immunomodulator, and then you say, by the way, I think you'd benefit from some dietary changes. Follow this program. We can't change anything that you prescribe. So we make that
yes.
very clear to patients that
Yeah.
you follow your doctor's recommendations on eye care. Here we're here to support that. We're here to support what your doctor is doing and give you the tools to basically supplement that and improve from inside out, right? So I think it's a really nice um it's a complement to what the prescribing doctor is doing, but it doesn't take over that.
That's a pretty in-depth, robust program that you have there for patients. The forum part and the fact that they get to speak to yourself and Dr. Futch, one on one like that is so huge because
Yeah,
this, I think, just better than anybody. A lot of patients who are dealing with chronic dry eye, there's an emotional component to it, right? A psychological
yeah,
component to it, and for them to have a forum where they can share their concerns and
yeah,
their feelings with others who are in a similar position, I think that's really
yeah.
helpful. That's really
And
great.
that's one of the, actually, what you said is important. That's one of, because of that psychological connection with dry eye, really any person, right? We have more stress and anxiety these days. Having, so that mental health component is in the program too. So we talk about the vagus nerve and the sympathetic parasympathetic nervous system and how that innervates your digestion, but also your glands. So like your lacrimal glands, meibomian glands, they're innervated by the parasympathetic nervous system.
Mm,
So how are we, calming down your sympathetic, your fight or flight, because that's what is on overdrive for most
mm,
people. But in dry eye, especially, that's important to, bring that attention to that, because as you've seen, a lot of these patients have anxiety, depression. They're especially around their eye problem, right? They
yep.
get super nervous and anxious about this, that this is really gonna take their vision. And so we take that component very seriously too, and really talk about it throughout the program. But then we have, again, a section on gut health and reducing inflammation. And so again, it's very what we like is that we can anybody can go through it, right?
Mm.
And the fact that it's accessible for any eye doctors who, again, maybe don't have the time to really learn all this, don't talk to patients, but they can refer their patient to this online program where patients can go through it, and that would benefit what they're doing already for them in their clinic.
That's wonderful. So what about from the provider side? So, full discretion here. I'm just started the program from the provider side. I just started to do a few of the what do they call, like the different
Modules,
modules. Thank you.
yeah,
And I personally, like I was telling you, I'm like a big anatomy, physiology nerd. I love learning about the body and all of that kind of stuff. So some of it's really review, but I enjoy it. I like learning again about how digestion works and all the different things involved. And I'm excited to learn about how this is going to help me kind of have this conversation with my patients and make that connection. What
yeah,
is it from the provider side? What does that program provide?
yeah.
An optometrist who wants to kind of learn more.
Yeah, I was really excited to see how much interest when we launched the patient program. We got a lot of interest in something for providers. So then we decided, okay, let's put together an educational masterclass, something that again, some of it is going to be a review. Obviously, we are healthcare providers, so we've learned some of this. But really, as you get deeper into the masterclass, you will learn a lot. Again, you'll learn about all the gastrointestinal problems uh, that we didn't learn about in school. Maybe you've heard about all the risk
Mm.
factors, and again, how to recognize. So if somebody has a symptom like this, you're going to recognize that, okay, so maybe they have IBS, and if it's not controlled, so they're not absorbing all the nutrients they're eating, so they're nutrient deficient. So again, you don't have to treat them, but just putting the points together, or linking the symptoms to the condition. I think that's really the goal of this master class, is that to give you the tools to, first of all, review, but also learn a lot of new things that you may not be aware of, to be able to comfortably and confidently talk to your patients about the link between their gut health and their eye health.
Yeah, even just the fact that I've gone through a couple of modules, there's one thing, there are a few things in there that already are valuable, but one thing that really, like a little light bulb went off in my head, where the connection between the gut and the eye all of a sudden made a whole bunch more sense. It was one very small thing, but I think it was like one of the markers, like the interleukin, I don't know, 17,
17.
with this inflammation in the gut is more of that present. And then, but that's the same marker that we find in our eye when there's inflammation on the surface of the eye. Did I get
Yeah.
that correct? So
Yeah,
that
yeah.
little
So
connection right there was,
TH17 and IL-6, but yeah, so it's
oh,
basically,
sorry, almost.
it's the mucous membrane, right? Like we're dealing with the same kind of it's a membrane that's on the on the lining of your gut, is a mucous membrane, and that's what's on the surface. So
Yeah,
it's very similar. So again, and we have to remember that 80%, up to 80% of our immune cells are in our gut. So we're dealing with dry eye, is that we've already all accepted it's an inflammatory condition. We have a lot of treatments that really target reducing inflammation on the surface. But if your gut is inflamed, so you're just like putting a band-aid on the problem on the surface
right.
with immunomodulators or immunosuppressants. Why do these people not get better when we put them on immunomodulators? They get better, but they have to stay on it, right? Because
Yeah,
we're blocking those receptors. Yes, we're modulating the inflammatory cascade, which is important. I'm not saying I don't prescribe immunomodulator. I love immunomodulators. But again, are we putting a band-aid on a problem? So
right.
why don't we, if there's a bigger issue going on in the gut, so if the gut is inflamed, this is going to keep firing up, right? The analogy I use for patients is, when I do, let's say I do like gut testing, and I see they have, severe dysbiosis, maybe they have some overgrowth of some pathogenic microbes, um, and they have leaky gut. So really, like, they're just so inflamed from inside out. I tell them, like, okay, what we're doing with your eyes is like we're putting a few trees with a in a fire, in a forest fire. Okay, you're gonna have to
Planting
edit
trees
this.
in a forest fire is what you're saying?
No, you're gonna have to edit this. Okay, so
No, I'm gonna leave it in there. I'm just kidding. Go ahead.
okay, so the analogy I say to patients is that if there's a forest fire, by just addressing, or by treating your eyes, we're just putting out a few trees, right? We're just, putting some water on a few trees. They're
Right,
going to burn back up again, because the
right,
bigger fire in the forest is not addressed. So
right.
again, that's one of the things, like with the gut, is the gut, if the gut is really inflamed, and we have all of our immune system, our gut communicates with everything, with our
Yeah,
brain, with our skin. So, again, rosacea patients is such a big thing. Like, oh my gosh, like, I know you see a lot of rosacea patients too, because you're doing IPL on these patients, right? So
mhm,
start asking them, how's your gut? How's your gut health? Have you ever been diagnosed with IBS? Do you have problems with, certain foods? And a lot of times they'll say, oh yeah, I've always had that. Or patients with that are, let's say, their allergy symptoms are getting worse. They say, oh, my allergies are just getting worse and worse every year. That's a symptom of dysbiosis,
interesting.
imbalance of your gut.
Interesting.
Your gut is just not healthy, because your allergy symptoms will get worse and worse. You'll start developing more allergies. Food intolerances is a big one too, because we'll just be, again, before I start learning about nutrition, I used to just kind of be like, oh, let's do a food sensitivity test, and you just avoid those foods. It's not normal to have food intolerances. So again, that's kind of a band-aid approach. Like, okay, let's just avoid those foods. But guess what?
Mm,
You're not treating the reason why you have intolerances to those foods. It's not an allergy, right? So food allergies is different. So those are like your, like you can't tolerate peanuts, you have peanut allergies.
Yeah.
That is something from childhood. But I'm talking about adult onset food intolerances.
Mm,
And by doing food sensitivity testing, yeah, you can identify, you eliminate them, but guess what? You're gonna have more foods you can't tolerate. So how much more can you eliminate? So it's really not, I don't love that approach. I love to look at like, why did you develop this all of a sudden and you continue to get worse? So let's treat the underlying cause of that instead of just avoiding, for certain food groups. Yes, you can still avoid them, but it's not gonna treat the problem. It's just
right.
gonna treat your symptoms.
Absolutely. And that's what we get caught up doing is treating symptoms and instead of getting to the underlying issue. Let's try to do something if we can do a little practice here of like something tangible for someone who's listening or watching. Let's say they have somebody, a patient in front of them. Maybe you would want to kind of craft the scenario so you can kind of better give us the example. But you have a patient, you're in the exam chair, you're in the exam room as an optometrist, and you're doing your regular 20-minute, 30-minute eye exam. And there's a person in front of you who you maybe are thinking has some sort of gut issue that's related to their eye. Like, how are we going to have this conversation? Somebody like myself who doesn't really have these conversations very much. How should I get started in that?
Yeah. Well, I think, first of all, doing a 20-minute exam, 20, 20, 30 is probably not the best situation or best setup to be able to talk about this because it takes time, right? So my new dry eye appointments are an hour long because they have a lot going on. So it does take time. But let's say like in a typical optometry practice where you do only have about 30 minutes, I think something, if they're obviously you want to maybe divide it, like if you're doing like their routine stuff first and then have them come back where you have a little bit more time to dive into some of the symptoms. So
Mm,
things that I asked, like that I mentioned about, I think having skin conditions. So if somebody has eczema around their eyes, if they're having to put steroid creams all the time,
mm,
that right there is a good, you know probable indicator. So I got, obviously not every single time, but very high chance that that patient has some imbalance in their gut. Allergies, maybe the allergies that are getting worse and worse is patients have to be on, which these are the patients we see all the time, right? Like you see patients with eczema, they say, doctor, what can I put on this? And you're like,
mhm,
you know what, there may be a gut connection, there may be something going on with your gut health that's flaring up your skin. So if you wanted to recommend certain things, I mean, again, I don't like the blanket approach, but you can kind of say, let's remove certain food groups. Like dairy could be inflammatory for that. So let's do a month, or even more, ideally like 2 months. But if you want to start with a 1 month, no dairy. Patients are not going to like you for that, especially if they
yeah,
love their cheese. But
yeah,
again, if you wanted to start with something, maybe bringing that attention to that, like that, hey, that could be a connection. The light bulb may go off in the patient's mind that, oh yeah, I do have like a lot of bloating, a lot of gas, and I feel like uncomfortable after certain foods. Like I never knew that was connected to my skin. Rosacea patients is a big one too, right? So you can be like, when you eat, when you are having certain foods, like, I mean, for them, we know like spicy foods and alcohol, like like fermented, high histamine foods
mm,
tend to flare it up.
mhm,
So
mhm,
you can, again, bringing that tension or kind of making the connection is the first place. Obviously, utilizing like if the patient's like, yeah, where can I learn more? The program might be something, but sometimes even just connecting with like your local functional medicine doctor. So maybe somebody
mhm.
you have in your community, like a naturopathic doctor or a nutritionist that you can partner up with, and just
Yeah.
have that referral sort of setup where you can send those patients. The problem, which it's not a problem with every, but I think the reason why we decided to do this program is because a lot of these nutritionists don't really know about eye health, and so that's kind of like with
Mm,
us, you get a doctor, eye doctor, plus you get a nutritionist. So we know a lot about both areas. So with working with the nutritionist, you may just have to kind of fill in the blanks a little bit. But again, it's not a bad place to be. Again, having someone that you can collaborate with and co-manage with. So recognizing or bringing that to patients' attention. So if they want to do more, then send them to the professional so who can do maybe some gut testing, like stool
Right.
testing and things like that, and looking at their microbiome and really targeting their, like dietary and supplement protocol. Because it really comes down to that. Like there's no blanket approach. Just like with dry eye, you don't have the same protocol that works for everyone, right? You
Right.
tailor your treatment depending on the patient in your chair. That's how I approach too. Like when I get asked from my colleagues, like, what's the diet that you recommend for dry eye? It's like, there is no one diet that fits all. Like, right? I wish that's kind of the big question, right? Everybody's like, what's the best diet out there? Like, let me just eat that. But it's very personalized. Like, it
Yeah.
has to be personalized approach. And you're also dealing with people, like, right? Some people will say, I will never do that. I can't force them to, give up their dairy. Like if they're not able to, you know, do certain, like remove certain things from their diet, again, we have to work with it. That's kind of the nuances when I went through this program with nutritionists, nutrition program, is that a lot of those like people that are not really professional nutrition. I mean, there's so much of that, right? Like in social media, everybody's like all of a
Yeah.
sudden a nutrition
Yeah.
expert. They're like, this is a diet to do. This, go vegan or go carnivore, do this and that. It's
Right.
like, well, I think a lot of those patients or a lot of those people don't really study nutrition because there are a lot of nuances. Like when you approach it like that, you can actually harm people
Yeah.
by
Absolutely.
forcing their bodies follow a certain nutrition protocol that's really doesn't work with their with their system. So
Yeah. In a
that's what
lot
I
of those
learned.
cases, yeah, sorry. In a lot of those cases, I feel like it's people who say, "Oh, this worked really well for me. You should do it too." But that's like obviously not the right recommendation to make.
Yeah, absolutely. Yeah,
So so in that case, yes, I agree with you right off the top. You kind of mentioned, 30 minutes probably not enough time to have this in-depth conversation. But during a comprehensive eye exam, let's say we're having this patient come back, or perhaps they've come back, like you said, they've come back 2, 3 times now with the same issue over this past 12 months, chronic dry eye or inflammation, blepharitis, whatever it might be, and you're kind of wondering like why are maybe my usual therapies not working as well. It might not be a bad idea to consider. Let's see if we can get your gut health tested, send you to the professional who could do that, get the right results. Like just the same way we're medical health care professionals, we provide treatment based on data and science and
yeah,
the
yeah,
findings that we have. We can't treat gut health issues unless we have data to show what the gut health actually
yeah,
is. So sending them to the right person there, and then maybe when they have the right information, then the program makes a lot of sense. Going to a program that can provide them with the
yeah,
information and really, like you said, walk them through the
yeah,
recipes and all these supplementation, all this kind of thing.
yeah, yeah. And I think again, Celia and I, this is our passion, obviously, but this was our goal with the masterclass, so gut health masterclass for eye care professionals. We wanted to create that for our colleagues who, again, want to learn more, so that way again they can start approaching this and having this conversation, and maybe they'll pursue it even further and like take on and start doing this themselves, or again pairing up with someone who does that in their area, and like finding the, just like with anything we co-manage, right? Like we're not, if you have a retinal problem that needs to be seen by a retinal specialist, you co-manage. And so again, it's just like finding your people that
Right.
can help, ultimately help the patient. That's the goal. And for me, as you know, I've been doing a lot of advanced dry eye treatments for a long time, and we've been doing like biologics here for the last few years with autologous serum and PRP, and so all of that is, basically I do like every advanced dry eye treatment that's available, but some patients still have issues that are ongoing, and this is where I feel like when I approach it from all angles, from like inside out, and talk about, especially with the, as we know with the new dues lifestyle report, gut health is highlighted there, gut health,
Mm,
sleep, mental health. So the evidence is there, so that way again, if everything we did like with advanced treatments was working, we wouldn't have all this other all
yep.
these other studies to say like what else is going on. And
Yeah.
so that's kind of why I when I started learning about this, is like I need to learn about, yes, there their detox systems, like what are they detoxing their, all the chemicals that's going in their bodies. And I want to know, are they, how's their sympathetic nerve and parasympathetic nervous system working? Is it in balance? How's their sleep? So it's not just diet. It's like, okay, talking to your patients, like you said, what else can we do? Talking about sleep, importance of sleep. Are they taking, we talk about taking breaks from screens and doing blinking exercises, but when do they turn off their phones, and when do they start unwinding so that way they get a good deep restorative sleep? Do they do that on a regular basis? You'll be surprised how many patients say my sleep is horrible. Like your dry eye patients will say my sleep is horrible.
So many.
Yeah, so it's like,
Want to work night shift.
exactly, yeah. So that's really, which is like, I mean, it's not a plug for our friends at UMA, but this is what I love about like some of the um, you know companies that are like recognizing, and that's one of them. Like, it's an OD owned company that really recognizes that mental health and sleep should be part of dry eye management. So I recommend that device. I carry it in my practice for my patients, and I use it myself. And I tell them about, like, it's not just a warm compress. This is something that works. Takes everything, like all that, the importance of unwinding and tapping into your parasympathetic nervous system. So I just love that there's more of us, more doctors, more providers that are bringing the knowledge and technologies to this space, because it's needed. A lot of these patients really need this help.
Yeah, it's well, yeah. Shout out to Yume, the Yume Rest. Shout out to Sharmeen Habib, for bringing that product out to the profession, because it's a really cool product. And that's just out of, just saying it because it's a good product and a good person
Yeah,
behind it. But the fact that you mentioned your dry eye, the aspects of what you do in your dry eye clinic, I think really helps elevate what you're doing to another level, right? You're already doing, like, as far as we know, the most you can possibly do to treat dry eye at the most advanced level. And that is when you see that, like, that's not the be all end all. There's more to it, because as we know, our eyes are connected to the rest of our bodies. Just in case, as a little reminder, just in case anyone forgot. And that there's other stuff going on, and we need to help try to control all those other things. And so
yeah.
diet, obviously, gut health is a massive, massive component of that. I know we're a little tight on time, so I want to give you a couple minutes to share any final words that you want to share, Mila, and then we're gonna have to bring you back on because there's so much more we're gonna talk about.
I know there's so much to talk about, but I guess my message, and this is to like any ODs that feel like, maybe getting burnt out, or like feeling like they're doing the same thing. I love this profession so much, and I feel like there's really nothing else I could be doing, or that I want to do out there. And it's really given me opportunity to expand my knowledge in all these, different areas, like going back to be a nutritionist, going back to school to be a nutritionist, because of, as an OD, that's opened up my path to pursue it even more, and specializing in something that you really are passionate about. Again, for me, it was dry eye and making a difference. I know, Javier, you can probably relate when you make changes in patients' life. Like, I mean, it's so rewarding, right? And
Mm.
patients, literally, I've had patients cry in my chair, say, "You gave my life back," and
Wow.
that's what motivates me. And
Yeah.
with the whole like gut health and nutrition has been even like more elevated. Like the things I get from my patients, that really is the reason why I keep doing this, is that they say, "Oh, I came to you for my eyes, and like now my skin is better, and
Mm.
I have better energy, I'm sleeping better." And
Mm.
so like they're so
It's
thankful
amazing.
that, and they tell me like I'm the only doctor who made that connection. They've had like gut problems all their life, and again, they've just been given like PPIs or some,
Mm.
some
Mm.
band-aid approaches for many, many years. But when somebody takes the time to actually listen, makes the connection, and actually trying to fix the problem, they are super, super grateful. And I mean, I get more hugs from my patients than I mean, even after, now that we're back to, hugging, I get hugs again, but just a lot of grateful patients. So I love that. And I just want to, spread that to my colleagues that, if you're not, if you're stuck doing something you don't like in optometry, there's so much more that you can do. So specializing something and really where you make huge impact in your patient's life.
That's amazing. That's a very important message to share. Thank you, because that does there is we're lucky to be in a profession that we can take so many different avenues, and there's never too late to, like you said, explore a new one. And perhaps you'll find something that you're truly passionate about, which you are. It's always really fun, really nice to see somebody who's truly passionate about what they do, who loves what they do. I think it energizes other people and allows them to feel like they could be that way too. They could do something that they enjoy doing too. They don't have to be stuck in a rut. So thanks for sharing that. Where do people go? ithrivewellness.com.
Yes, I Thrive Wellness is our new company. That's where both programs are. We're gonna even have more things there. So make sure to stay tuned. Um, uh, my Instagram, like that's I'm pretty active there, but that's a place to find me is I Dr. Mila, and also I Thrive Wellness is we got an Instagram there, so we put
Good.
out some content there as well. So that's a place to
Perfect.
follow
So
us as well. And
follow
I
Mila
I
on Instagram
yes, I
and follow
Thrive
Ethel.
EY. Sorry, I Thrive is EYE.
Oh yeah, right.
Thrive. Yes,
EYE Thrive Wellness and
yes,
also EYE Dr. Mila.
yes, yes.
Okay, good. Good to know. That's a good distinction to make. All right. Thank you so much, Mila. Thank you for, I know we've been working on this for a little while, so I appreciate you coming on. Thanks for putting this program together. I already, like I said, I've been enjoying it from the practitioner side, the education. So I encourage all our colleagues to get out there and learn more about this because it's going to be able to improve our patients' lives and our outcomes so much more. So thanks again for coming on to share that. And thank you, everybody who's tuning in to the 2020 podcast, Canada's #1 optometry podcast. I'm always grateful for all the support. Once again, please do leave us a review, and I'll see you again in the next episode.